Our big number, and it is an alarming one, 1,902. That is how many American children have been hospitalized with COVID-19 just over this past weekend, a pediatric pandemic high as the Delta variant continues to spread. And of course, there is added concern as this is back to school season. So, Jen, we're seeing COVID cases rise. We're hearing evolving information about those booster shots that we may need. And now there is some renewed attention on a COVID-19 treatment that we know the governor of Texas is receiving.
Right. So let's do a deep dive on this monoclonal antibody treatment, because this really needs to be more on people's radar. So first of all, for some background, it was initially used in hospitalized patients and those who were at high risk for severe disease. Now the FDA has authorized it in the outpatient setting for patients who test positive and also have some high risk factors. Now, this is interesting. Previously, it was only available via IV, intravenous. Now that has changed. Now you can get a series of 4 injections. Timing matters, though. It should be given within 10 days of testing positive or developing symptoms.
Okay, a lot of questions about how effective it is and how much it costs. Is this something available to everyone?
So people need to know about this, because in the outpatient setting, they really do need to ask their provider about it. But studies have shown 70% efficacy in reducing rates of hospitalization and death. That is such an important number. There are no significant safety signals in terms of that profile, and the cost is free to patients. However, the government is paying the drug maker about $2,100 a dose, and I have to emphasize, Amy, this is not a substitute for vaccination. But as we talk about boosters, as we talk about prevention, screening, diagnosis, we have to talk about treatment, and this is underutilized, and people need to be more aware of it.
All right. Thank you for bringing it to our attention, Dr. Jen.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.